Well, the next step is to do another cohort. Cohort 3 looks very good, but not all of the patients had complete suppression. You know, some of the patients required some injections. That partially could have been due to the technique. In one of the patients, the subretinal injection wasn't ideal, but we also feel like we're maybe right on the threshold of having a dose that's going to be effective for the vast majority of patients, because there's heterogeneity in neovascular AMD. Some patients express quite high levels of VEGF, other patients express lower levels. For this treatment to be really effective, it's necessary for it to suppress VEGF in all patients, so that whether or not the patient's a high expressor or a low expressor, you get good sustained suppression of the VEGF, so you have long durability. And so the next cohort, we hope, will provide even higher levels than seen in cohort 3, and that could result in more consistent results in all patients. You know, it's given in the operating room. That's a little bit of a barrier. You have to bring the patient to the operating room, do a vitrectomy, and then inject the vector under the retina. But it's actually gone quite well. There haven't been major complications of that. There was one patient who had a retinal detachment that was repaired. That patient has done extremely well. That's one of the patients that hasn't required injections. So the patients themselves are really quite happy with this approach, because you can imagine after years of getting injections to suddenly have a treatment and that then not require injections and maintain your vision, that's very satisfying for those patients.